call Mr Nigel Dodds for supplement.
Deputy Speaker, and obviously I tabled this question referred to Whiteabbey and Mid-Ulster, but my remarks will be mainly about Whiteabbey, and I'm sure other members from the Mid-Ulster area will want to comment on their own constituency interest. I'm grateful to the Minister for his reply, but he will be aware, Mr Deputy Speaker, of the very great distress, indeed anger, that has been voiced on the ground in my constituency and indeed further afield at the suddenness with which this decision to bring forward closure of services was taken. And it has had a major impact on patients, first of all, prospective patients, but staff as well, whom I met when I visited the hospital on Friday and spoke to the consultant doctors, staff, auxiliary staff as well, who were all extremely perturbed at what they see as a breach of the agreement, which was that these services, A&E and cardiology, would be removed to Antrim Area Hospital in 2011. It's clear also, when I met the Trust Chief Executive on Friday, Colm Donaghy, he says it's not a matter of money, and therefore it must be a question of management, because clearly such a situation, as has been outlined by the Minister, hasn't been arrived at overnight or suddenly. And therefore, what makes it an emergency now when it wasn't an emergency previously? And I'm asking the Minister, instead of approving this suggestion and proposal from the Northern Health Trust, to take time to review it, to allow the decision to go ahead as previously for a transition next year, and also, Mr Deputy Speaker, why cardiology services have been included in the transfer of services from Whiteabbey, and the issue that has been raised by staff and by patients about the ability of Antrim Area Hospital to cope.
Thank you, Mr Deputy Speaker. There are a number of points there in Mr Dodds' remarks, and I'll try to address them as best I can. As far as time is concerned, this was consulted on and agreed upon as the way forward in 2002, so there has been a long run-in period. When I came into the Department of Health, my view was that we would sustain these services for as long as possible, for as long as patient safety allowed. And the key overriding principle is, of course, patient safety, literally your lives in their hands. What has changed? What has changed is that senior clinicians are leaving the hospital, are leaving the service. And when the senior A&E consultant comes to me, as she did on the 26th of April, and said to me, we can no longer sustain this service safely, that this service will no longer be safe following the departure of the staff on the 24th of May, I have absolutely no choice other than to follow the guidance laid down by senior clinicians working in the Trust. As far as staff is concerned, there will be, I regret, the short period of consultation, and I will certainly make steps to ensure that unions are better informed and better included in any subsequent decisions that have to be made at any other sites. No staff will lose their job, there will be no redundancies. All service staff, for example, will maintain their employment on the current sites. It will affect doctors and it will affect A&E nurses. The reality about Antrim is also, and I am assured again by clinicians and by the Trust, that the Antrim Hospital will cope, can cope, and also that the strengthening of the service by the additions of staff from Whiteabbey and from Mid-Ulster will create a better service in Antrim. Currently, over 70% of the visits to the Mid-Ulster and Whiteabbey A&Es are minor injuries, so we're not talking about all of the visits. And of the remainders, a number of those, of course, will not need admissions. So it is in terms of the numbers, I have sought that assurance and been given that assurance that with the changes that are being laid down in Antrim Hospital, the additional beds, the changes to the A&E and so on, that all of this will be accommodated. I would have preferred the service to continue for as long as was possible and made that clear to the Trust on a number of occasions. But as the Minister, when I am faced with a senior clinician, the senior A&E clinician, and her staff saying to me that patients could come to harm given the service was the vulnerability of the service, I have no choice other than to act.